Good morning, this is Dr. Naomi Simon. We're here at Mooresville Dermatology Center and we're going to demonstrate how to apply your acne medications and how acne patients should wash their face in the morning and evening. And here with me to demonstrate is our very own medical assistant, Ashley. And Ashley's going to demonstrate the whole process for you. And one of the great things about getting your skincare here at Mooresville Dermatology Center is we have several excellent medical assistants who know a lot about dermatology and who can answer many questions that patients have when they call in about, whether it's how to apply their medications at home, what side effects they might experience from their medications, how to wash their face, lots of different things. So we're going to go ahead and demonstrate for you. The first thing we're going to do is say Ashley just woke up in the morning and she's going to do her morning acne regimen. In the morning, we want to wash our face just very gently. We haven't really gotten our skin exposed to anything dirty overnight while we're sleeping, so we just want to gently cleanse our face. And Ashley's going to start with our Revision Brightening Facial Wash, which contains alpha hydroxy acids, mainly glycolic acid, which helps get rid of dead skin cells and kill bacteria and improve acne. So we're just going to watch Ashley wash her face. Here we go. You see she's just gently getting the skin wet there. And with her hands, we don't need to use a buff puff or a washcloth to wash our face, and sometimes with acne-prone skin that can actually make it worse because it's too irritating. She's going to apply a little bit of the Revision Brightening Facial Wash. Just with her fingers, not too much, just enough to really coat the skin. And then she's going to let it sit for a few minutes. Ashley is now going to just rinse her face off gently with her fingers. Again, we don't need a washcloth or a buff puff. We just need to rinse our face with our fingers and some lukewarm water. We're going to gently pat our skin dry, not harshly rubbing our skin dry. And a lot of acne patients like to use a toner, and generally we avoid alcohol-containing toners because even for acne-prone skin, they can be very irritating. So we're going to have Ashley use our Brightening Facial Soothing Rinse, which is a toner by Revision, and just take a cotton ball and just gently go over her face with it before she applies her acne medication. This helps rebalance the pH of the skin and just get rid of any remaining wash. Okay, and now we're going to actually have Ashley apply her morning acne medication, and usually in the morning we'll have patients apply a benzoyl peroxide clindamycin topical medication combo. This is an easy way to put your acne medication on. It's only one product. The one that we're going to be demoing is Acne gel, but you can use generic benzocaine, and either of these medications just goes on as a light gel. It dries right away, and then you can go ahead and put your sunscreen and your makeup on top of it. So Ashley has Acne gel here. This is the benzocaine combination gel. And we're just going to have her use about a pea-and-a-half size to cover her whole face. So one way to get this evenly applied is to take a little bit of that drop and just put it on one cheek, apply it, spread it around, then put it on the other cheek and spread it around. And you don't want to spot treat acne, and the main reason is because you don't know where your next pimple is going to pop up. So if you only spot treat the ones you see today, you won't be treating all of the skin to prevent new ones tomorrow. So you notice how Ashley's just rubbing it in her whole entire face. It's not causing much irritation or redness. If you do get some redness or burning or stinging when you're applying the benzocaine gel, that can be completely normal. As long as it goes away within a minute or two, it's fine. You don't have to stop using the product. And her gel's all rubbed in. Looks perfect. No white areas. The next thing she's going to apply, because it's morning, CeraVe AM Cream. And you can use any morning sunscreen. The reason we like CeraVe is because it's non-comedogenic, so it doesn't cause new pimples. And it's really light. Moisturizer goes on well under makeup or foundation. And it has an SPF of 30 in it, so it protects your skin throughout the day if you're doing normal activities. Not enough if you're going to be going out in the sun for hours, then you need to reapply. And again, she's just rubbing in a thin layer all over her face, and she's just going to rub it in until all the white goes away. Yeah, and we want to make sure to get it on our chin, our nose, and actually would like to also get a little bit of sunscreen on our lips. A lot of people forget to put sunscreen on their lips, but it's a place that gets a lot of sun exposure. And that's just perfect. Ashley, you're ready to go. Thanks. Now we're here with Ashley and we're going to demonstrate the evening acne cleansing regimen. And the difference with this regimen in the evening is that Ashley is going to wash her face with not only the brightening facial wash but also the Clarisonic face brush. And for most patients, once a day to wash with the Clarisonic is fine. You don't need to do it twice a day. We like to use it in the evening because if you do wear makeup or foundation or sunscreen like we demonstrated earlier, you want to get all of that off before you go to bed at night. And also, a lot of us play sports or do some workouts and we want to get all the extra sebum and sweat and possibly dust that has gotten onto our skin off without overly irritating it. The Clarisonic brush is a unique product by the Sonicare company, and the difference between this brush and the other ones that you may be able to purchase at the drugstore are that the Clarisonic brush oscillates 300 times a second to gently clean the skin and open the pores and get all the daily dirt off of your skin without torquing or twisting or irritating your skin. So we're going to demonstrate how to use it, and the Acne Mia is what I would recommend for most of my acne patients. Okay? Again, Ashley's just gently going to wash her face with lukewarm water. Get a little bit wet there. Use the glycolic acid face wash. And gently apply a little bit, not too much, to the facial surface. Then Ashley's going to actually get the Clarisonic brush wet. And she's going to go over one area at a time with the brush. And you see how the brush just goes on her cheek. She gently rubs it all the way around the cheek. And she's going to move over to her other cheek. And you don't have to push hard. The brush beeps when it's time to move to another facial area. And she's going to move to her forehead. It's very gentle, not irritating to the skin at all. Getting all the makeup and oil off the skin. And lastly, finish up with her nose. You can do a little bit more deep cleansing right in those crevices of the nose where you tend to get more blackheads. And then once that Clarisonic brush is done beeping, it'll turn itself off and you can go ahead and rinse the gentle cleanser off your face. It comes in this nice little stand. The other thing about the Clarisonic that's great is it's waterproof, so you can actually keep it with you in the shower and wash your face in the shower if you take a shower at night, and then you won't have to worry about remembering to use it. She's going to pat her face dry again very gently and then apply another round of the toner. Now most people apply a medication called tretinoin or Retin-A for their acne in the evening, and the reason is because in some cases it can be broken down by the sun's rays. If you put it on in the morning, the sun may actually affect your acne medication. Also, Retin-A does make your skin a little bit more sensitive to the sun because it thins out that very top layer called the stratum corneum, which is the top layer of dead cells in the skin, and it makes you have less dead skin cells, which makes your skin look fresher and newer, but it's not quite as thick with protecting you from the sun. So that's another important reason why we wear our CeraVe AM sunscreen in the morning.